FMT, fecal microbiota transplant. What is it? Why is it so important? And what are clinical guidelines for its administration? Let's first begin talking about C. diff. Yes, Clostridium difficile. C. diff has endospores that survive the pH of the stomach and eventually end up in the large intestines, causing a disruption in the microbiome. Signs and symptoms are diarrhea, fever, appetite loss, fatigue, and abdominal pain. But what does C. diff have to do with FMT?
C. diff is usually treated with antibiotics. Vancomycin is the main antibiotic prescribed for the treatment of C. diff. It is given intravenously and in oral tablet form. But does vancomycin even work for the treatment of C. diff?
Well, yes, it does work. However, according to researchers Dina Cao and Susie Hoda, it may be an effective treatment for C. diff, but research shows that it actually increases the risk of getting C. diff again in the future. So what do we do for people that keep getting recurrent C. diff due to vancomycin treatment?
This is where FMT comes in. FMT is the most effective therapy for recurrent C. diff. FMT is taking the fecal matter of stool from a healthy donor and transplanting it into a patient whose healthy gut microbiome has been suppressed by antibiotics, causing a bad bacteria known as C. diff. What are the patients thinking when they hear FMT?
Yuck!
I don't want another person's poop in my body.
Now, here are some helpful guidelines to think about in regards to FMT. In recurrent C. diff treatment, use vancomycin and FMT for improved patient outcomes. Make sure the patient knows everything that they need to know about FMT administration and their preferred route of administration. FMT donors can either be from family members or the stool bank. The family members are considered donors because they normally share a similar microbiome. 50 grams of donor stool is the minimum that should be used from a clinical screened donor, proven to be healthy and fit for donation.
As we talk about fecal source, it is important that we talk about the stool donor bank also. According to openbiome.org, the process of a donor is to join the registry, take the health questionnaire, attend the clinical interview, complete blood and stool screening, and then donate. Then there is a complete follow-up screening so that they know if they will be able to use the stool. How do they know? They test the stool and blood to make sure the donor does not have any other infectious pathogens or risk factors.
There are several ways to administer FMT. Colonoscopy, enema, and oral pill are 3 common ways. In colonoscopy, the stool is mixed with normal saline until liquefied, strained, and then drawn up into a 60 cc Lorlock syringe. The enema route is prepared in a similar way. For the oral pill, it is desiccated prior to being put into a capsule.
It is important to give the patient a choice in administration when possible. Here are some of the pros and cons. Colonoscopy is an invasive and expensive experience, but providers are able to identify other potential disease processes. Oral capsule is easy to administer and cheaper than a colonoscopy, but patient perception of putting stool in their mouth is a negative. Enema is uncomfortable, but is a quick route for administration and can be done at the bedside.
So, to wrap it all up, as a nurse, how do you approach a patient receiving FMT? Informed consent is the most important component. It is important to educate the patient on what is known about FMT, what is not known, and potential risks. Educate the patient on routes of administration and best options for the patient. Who knew poop could save lives?